because if the mwananchi does not prioritize their health, the government is really, or the country is really just or the person is in a microcosm what the country is.
Speaking of common mwananchi and prioritizing their health, there was a time I had a patient who came with a child. They came with their parent. Alikuja kama msukuma kwa baiskeli. They were in severe pain. Had a strangulated hernia. I was called. I was ready to sort it out. Yeah. But then they had no money. Yeah. And we told them, no problem, this is an emergency, we're going to do it, you'll just pay later. Do you know this mwananchi did? They walked away. They refused. They actually signed to be discharged against medical advice because they were afraid of a bill to come. So if you tell mwananchi to prioritize their health, mwananchi will prioritize food. Because the very common, you say common mwananchi and you think of you and I. You and I might not be very common. The commonest down there, the commonest mwananchi will prioritize food. I'm not going to pay 10,000 for my child. Yeah, when I can, this money I can use it elsewhere. Yeah, naambia hata mzee si utauza ng'ombe. Hapana. Not on their budget. So I don't think it's good to put the pressure on mwananchi who might not understand what their health is, because there are some mwananchis who will just see a kidonda on their foot and just a kidonda.
But this mwananchi goes and votes. You see, if this mwananchi is one who goes to vote and they don't prioritize their health, they will vote for a person who doesn't prioritize health. You see, and then that person will pass laws that don't prioritize health.
Yeah.
And then they will approve a person to be appointed cabinet secretary or whatever who doesn't prioritize health.
Yeah.
And so the problem now remains that we are in a problem that started from the mwananchi.
Do you think doctors, as doctors, do we prioritize the health of our patients?
Doctors generally prioritize the health of their patients.
So now we are going on strike.
Yeah.
Do you think it's a good move? Today actually doctors were suspending services from midnight. Hatukanyagi hospitali. Yeah.
It's an unfortunate outcome.
By the way, it might seem to the public that doctors like to go to strike. But actually it's the worst thing. And we do understand that.
Doctors generally do not like going on strike. A lot of times by the time doctors go on strike, they usually have really tried very many other avenues to try and address issues. And most of the times, doctors don't even go on strike for salary concerns, for their money.
Exactly.
Most of the times, doctors have gone on strike. They've gone on strike because of working environment. And the working environment, I could decide as a doctor, if my working environment is not good, I'll come and I'll only do that which I'm comfortable doing and leave at the end of the day. So for me to go on strike as a doctor because of working environment, the truth is that I am actually going on strike on behalf of the patient. Why? Because the patient can't. And the working environment is making me unable to attend to the patient.
To your patient.
Because if I'm paid at the end of the month, if I'm paid regardless of how many patients I see, regardless of whether I
do a good job or
not, I will just come and work with whatever tools that are there, do whatever I can do, and if something is below standard, I just say I can't use that tool because it's that instrument because it's below standard, and I sit and take tea at 10 o'clock and wait, and at 5 I go home. You see, I will not lose much.
On the previous episode, I was telling Dr. Lavender, she was the guest. I was telling her about for her she's had the privilege of only working in a private hospital and a good private hospital for that matter. And I was telling her what it is like to work in a public hospital, and she couldn't really believe it because public hospitals are actually sometimes they do a big disservice. Well, you have the doctors. You've employed your few doctors. I must say, they're usually few in number, or Toshi. But then even those who are there, they cannot do their job satisfactorily because the resources are just not there. So these strikes doctors go to. To what end? Because it's not the first time.
As I was saying, it's unfortunate that we are having to go on strike
Again.
in fact again. But some of the issues that are being raised by these doctors who are going on strike are actually legitimate
very
issues
legit.
that need to be addressed.
they're very legit.
Because if when we don't have interns at the hospitals, then what you've done is you've broken the healthcare system.
Yeah.
Because interns form the base. So when there are no interns, there are certain things that will not be done efficiently.
Yeah.
No. There are certain things that will not be done efficiently, and there will be gaps. It's like not having consultants
Exactly.
along the hierarchy. You see, the same as not having interns uko chini. So that needs to be sorted. The other issue is this payment of fees for registrars. It may not be necessarily a labor issue per se, but it's a real concern because someone has been released to go and study. The person has spent the last 5 years studying, okay, or the last 3 years studying. Their life has generally stagnated outside of their studying, and then you fail to remit the fees which you are supposed to remit. What then are you saying? You see, when you fail to remit that fees, this person will repeat that year. That's a year wasted.
Imagine.
You see, and so
and it's a year being wasted, and yet these people are not training for themselves. You do not become a specialist doctor for yourself or for your family.
Yeah.
It's for society.
Yeah.
And people might not see it, but it is very important to have continuity of training. The DSG for the union was saying the other day that it needs to be part of your career as you're signing for a new job in a government facility or even private. You need to actually have a clause that states how your training is going to progress, because you're not going to be stagnated at the same level forever. They need to have a way of facilitating your training so that you can come back and bring back the same knowledge to the people.
It's really a conversation that we need to have as a health, as a country, as far as health is concerned. And it's not just training per se for doctors. No, it's training for all healthcare workers. It's in the best interest of our country's health that we have persons specializing and getting a better.
And there is a big shortage,
You see, so we need to have that conversation. We need to have a conversation on how are we going to effect this training. You see, including even then, let's get the way we do private, public-private partnerships to deal with certain projects of government. Then even if it means getting a private partnership arrangement on how training will be facilitated for healthcare workers. But you see, when the first instinct or impulse when you're faced with this problem is to start thinking how you will stop the paying salaries for interns, then you're being lazy intellectually. You see, the rest of the world pays their interns.
Who are you?
Okay, the rest of the world pays their registrars, the doctors in training. It's actually work.
It's work.
Yes,
and registrars do the bulk of the work in these referral hospitals. They do the bulk of the work.
For you to know that all these employers know that these people are working is for you to be a registrar and you're a registrar from outside this country, you need a work permit.
Exactly.
For you to be a registrar, you need a license to practice.
You see, it's
so
work.
they know it's work, but they don't want to pay for it, which is what I was telling you. We have this culture where people don't want to pay for
services.
For services, whether at private level or at public level, we want to get free things. We expect to get free things, and when we live in a society that is capitalistic, that won't work. And even a socialist society, we still pay for it. Just that we pay communally and get the resources communally.
Exactly.
You see, but you have to pay. You have to work hard.